Hello, my name is Maria Cito. I'm a registered dietitian on the Integrated Stroke Unit at Mackenzie Health. Over the next 30 minutes, I'll be talking about lifestyle changes after a stroke, what you need to know. I will be going over some secondary preventive strategies and spend most of my time on diet-related modifiable risk factors and their associated diet modifications. Evidence exists in the medical literature indicating a combination of diet modifications, exercise, stroke preventive medications, and blood pressure medications can lower the risk of a recurrent stroke by almost 80%. It is beyond the scope of this presentation to address all strategies. However, you can find information on some of these strategies by checking out other presentations that are also a part of this Patients and Families Education series. Let's begin by talking about the first diet-related modifiable risk factor, overweight and obesity. Overweight and obesity are known to increase the risk of high blood pressure, type 2 diabetes, and abnormal lipids. They also increase the risk of cardiovascular disease, for example stroke, especially in young and middle-aged adults. There are two ways of defining overweight and obesity. Body mass index, or BMI, is based on a person's height and weight and is calculated by dividing weight in kilograms by height in meters square. Normal BMI for adults less than 65 years of age is between 18.5 and 24.9. Body mass index between 25 to 29.9 is considered overweight, and anything 30 and above is considered obesity. There's a drawback in using BMI. Muscle is not distinguished from fat. A person who is exceptionally athletic may have a higher than normal BMI. Another way of defining overweight and obesity is waist circumference. Waist circumference gives a good indication of fatness around the waist. Ample of evidence exists indicating fatness around the waist carries higher health risks than the amount of fat we carry on our hips. There's also evidence indicating waist circumference relates to the risk of stroke much better than BMI. The cutoffs for waist circumference vary depending on ethnicity and gender. For those who are European, Middle Eastern, and Eastern Mediterranean, for men, waist circumference should be less than 94 centimeters or 37 inches. For women, less than 88 centimeters or 35 inches. For South Asian, Chinese, South and Central American, for men, less than 90 centimeters or 35 inches. For women, less than 80 centimeters or 32 inches. Heart and Stroke Foundation of Ontario has detailed instructions on how to measure waist circumference, and you can go to www.heartandstroke.on.ca and search for waist circumference. If you are overweight or obese, modest weight loss of 5 to 10% of current weight has been shown to reduce LDL or bad cholesterol, reduce triglycerides, and improve blood sugar control. Losing merely 4.5 kilos or 10 pounds is enough to reduce blood pressure by 7.2 systolic and 5.9 diastolic. Most people do lose weight when they are in the hospital. If that happened to you, consider what you have lost a bonus. Your first goal is to not put the weight back on. Portion control is a good way to get you started. Think about what you normally put on your plate at a meal on an average day. First of all, your plate should be no more than 10 to 12 inches in diameter. A quarter of the plate should be meat, fish, poultry, or legumes. Another quarter, your grains or rice, leaving half of the plate as vegetables. You should finish your meal with a milk choice and a fruit choice. Other modifiable risk factors of stroke include smoking, sedentary lifestyle, which not only means sitting too much, but also lack of exercise. Excessive alcohol. If you don't drink, there's no reason to start. Generally speaking, no more than 2 drinks per day is recommended. For women, especially those of lighter build, no more than 9 drinks in a week, and for men, no more than 14 drinks in a week. 1 drink is equivalent to 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of spirits. Alcohol does not mix well with certain medications you may be taking after a stroke. Always check with your doctor before you drink again to ensure unwanted interactions with medications are avoided. The next diet-related modifiable risk factor I want to talk about is high blood pressure. Canadian statistics indicate 1 in 5 adults have high blood pressure. High blood pressure not only increases the risk for stroke, but also heart attack, kidney disease, and congestive heart failure. By now, it is common knowledge excessive sodium intake increases the risk of high blood pressure. Canadian guidelines for adequate intake of sodium ranges between 1.2 to 1.5 grams per day for adults. For those who are middle-aged or older, of African descent, have diabetes or kidney disease, tend to be more sodium sensitive and may require stricter sodium intake, targeting 1.2 grams per day. Upper limit of sodium intake above which adverse events may take place for young adults to 70 years of age and older is 2.3 grams per day. The truth is we eat more than 3 grams per day. We need sodium, but we eat more than double the amount we need. Cutting back sodium to target levels decreases the risk of cardiovascular disease by 13%. The most common form of sodium is salt or sodium chloride. Sodium also exists in other forms such as baking soda, sodium nitrate, sodium benzoate, and monosodium glutamate. Just to give you a sense of how easy it is to obtain sodium, half a teaspoon of salt gives you 1 gram of sodium, which comes very close to the recommended intake for some individuals. Here is a list of some common foods and their sodium contents. 1 slice of pizza has 1.8 grams of sodium, 2.5 pickles 1.5 grams, ham and egg breakfast 1.1 grams, 10 pretzel twists 1 gram, and 1 cup of canned vegetable soup 1 gram. Where do we find sodium mostly? 7 to 80% comes from what we eat in restaurants and processed meats. A fair amount of sodium is also found in breads and rolls, salted meat or fish, cured foods like sauerkraut, canned meats and vegetables, hamburgers and soups. Only 5% of sodium comes from the salt shaker. Brand names do matter. Make sure you compare products before making a purchase. There are many ways of cutting back sodium. Cutting out salt at the table. Do not use any or as little as possible in cooking. Use fresh foods and avoid processed or convenience foods. Learn to read the label. Ingredients are listed in descending order. If you find salt or sodium among the first few ingredients, a red flag should be raised. Experiment with fresh or dry herbs and spices. If you use salt substitutes, make sure you stay away from the potassium-based salt substitutes. Another common diet-related modifiable risk factor for stroke is high blood cholesterol. The first thing you need to do is to limit saturated fats, also called bad fats, to achieve better cholesterol results. By avoiding lard, hydrogenated palm oil, coconut oil, and solid fats, such as those in meats, hard margarine, and butter. Eat no more than 6 ounces of lean meats per day. Have some meatless meals such as legumes twice a week. Choose low-fat cheese and milk products. Limit high cholesterol foods such as whole eggs to no more than 2 a week. Also limit trans fats, also called bad fats. Trans fats not only raise LDL or bad cholesterol, they also lower HDL or good cholesterol. Trans fats are converted when liquid oils are hydrogenated to form semi-solid fats, Limit trans fats by avoiding products containing partially hydrogenated oils, such as bakery goods like donuts or cookies, and fried foods like French fries. Use vegetable oil instead, or if you use margarine, make sure it is non-hydrogenated. Reduce the total amount of fats you eat. Instead of frying, use low-fat cooking methods such as microwaving, baking, grilling, poaching, steaming, or broiling. Substitute saturated fats with polyunsaturated and omega-3 fats, termed the good fats. These are essential fats that cannot be manufactured by our body. They also lower LDL or bad cholesterol, and lower triglycerides, which in turn raise HDL or good cholesterol. They also reduce the stickiness of blood and plaque formation. Here are some good sources of omega-3 fats. Fatty fish such as mackerel, salmon, tuna, herring, trout, halibut, and cod. Nuts and seeds like ground flax seeds, walnuts, pecans, pine nuts, and pumpkin seeds. Some good oils include canola, soybean, walnut, and flaxseed. How much good fats should you use? At least 1 tablespoon of good oil a day is recommended. 3 ounces of fatty fish at least twice a week. A handful of nuts regularly consumed has been associated with reduced risk of cardiovascular disease. Therefore, 1/3 of a cup of nuts like walnuts, peanuts, almonds, or pecans 5 times per week is recommended. A caveat, however, nuts are very high in fat. Watch the amount you eat to avoid unwanted calories. Avoid fish oil supplements, since large doses may increase the risk of bleeding. Viscous fiber is another diet component which will help to lower blood cholesterol levels. Viscous fiber binds cholesterol and interrupts fat absorption in the intestine. It reduces both total and LDL cholesterol. Some good sources of viscous fiber include oats, barley, dry peas and beans, or legumes, psyllium, eggplant, and okra. 10 to 25 grams of viscous fiber per day is recommended. Again, some foods that are high in viscous fiber and the amount they contain are listed on the slide. Plant sterols are plant chemicals that have similar structure as cholesterol. They are naturally occurring in oils, nuts, and seeds. They decrease the absorption of cholesterol and lower LDL. 2 grams of plant sterols per day in divided doses are recommended. Sterols fortified food sources like margarine and yogurt are now available in Ontario stores. Diabetes is a huge topic in itself, and we won't be talking about this in detail. Without saying, when you have diabetes, keep your blood sugar levels as close to target as possible. I cannot emphasize enough, go to the nearest diabetes education center and be educated on how to manage diabetes at home. Another important diet modification to make is to increase your intake of antioxidants and minerals found mostly in grains, fruits, and vegetables. These foods have a negative association with the risk of stroke. They contain antioxidants which protect the arteries from oxidative stress and atherosclerosis. They also contain dietary minerals such as potassium, calcium, and magnesium that help to control blood pressure. A crucial reminder is to choose a variety of colors, especially fruits and vegetables. Whole grains are preferred when eating breads, pasta, and rice. 5 or more servings of fruits and vegetables are recommended daily based on Canada's Food Guide to Healthy Eating. 1 serving of fruits and vegetables is equivalent to 1 cup of salad, half a cup of cooked vegetables, 1 medium fruit, or half a cup of cut-up fruit. Vitamin pills, especially single vitamins, are generally not recommended unless they are prescribed by your physician. A word of caution, black licorice and foods made with licorice root may increase blood pressure. If you are taking blood pressure or cholesterol lowering medications, stay away from grapefruit or grapefruit juice. pomelos, and Seville oranges, since they may affect the potency of these medications. Last but not the least, physical activity reduces the risk of all types of stroke. Any meaningful movement after stroke can be considered as activity. Determine what you do, but the most important thing is to do it on a regular basis. Thank you. This concludes my presentation. I hope I have given you some helpful information as you decide on the lifestyle changes you need to make as you continue the journey of stroke recovery.